Hey everyone, welcome! Today we are jumping right into a really critical aspect of men's health. We're doing a complete deep dive into the prostate gland, looking at its anatomy, the warning signs to watch out for, and the whole spectrum of treatment options out there. Our goal here is to arm you with the real, science-backed facts so you can make super informed decisions about your own body. Let's get right into it.
So, here is our roadmap for today. We're going to start with the walnut-sized powerhouse, then cover recognizing the warning signs, move into medicines and non-surgical fixes, talk about traditional surgical options, and wrap things up with modern and alternative therapies.
All right, Section 1, the walnut-sized powerhouse. Let's dive into exactly what this gland is.
Physically speaking, the prostate gland sits deep down in a male lower abdomen, right at the base of a bladder. And it's pretty small. Literally about the size of a walnut. But here is the absolute most crucial detail. There's a 1-inch section of the urethra that passes directly through the center of this gland. I want you to picture a bottleneck, or maybe a really tight traffic intersection. If this walnut-sized gland swells up or grows even a tiny bit, it immediately squeezes and puts physical pressure right on that urethra. And, well, that physiological bottleneck, that's the root cause of pretty much all the issues we're unpacking today.
You might be wondering, just how common is this? Well, if we rewind about 25 years, the data shows that 3 out of every 10 men at age 50 were dealing with prostate infections. 3 in 10. These were usually caused by bacteria like streptococci or gonococci. But, and this is a huge win, thanks to modern antibiotics, that infection rate has plummeted. It's honestly a massive triumph of modern medicine that has completely transformed the daily lives of millions of guys out there.
Okay, so what does this little gland actually do? Essentially, it produces a milky white fluid which classical medicine traditionally refers to as mousy. This fluid is just absolutely fundamental to male reproductive health. It doesn't just nurture and protect sperm, it literally gives them the crucial strength and energy they need to move. Without it, the whole reproductive process just wouldn't work. So yeah, it really is a biological powerhouse.
Moving right along to Section 2, recognizing the warning signs. Now, these symptoms usually don't just hit you all at once out of nowhere. It's more like a cascading effect that slowly chips away at your daily life. First, you'll probably notice you're waking up a lot at night to pee, and the flow is interrupted, which obviously just wrecks your sleep. Then, you might start feeling a distinct pain or a burning sensation. If things escalate, you might actually see blood in the urine. And on top of all that, there's often this continuous, just exhausting ache in the lower back, the pelvis, and the upper thighs. It's a progressive domino effect that can seriously drag down your quality of life.
But hey, I want to pause right here and offer some major reassurance. In the vast majority of cases, these symptoms are just the result of a benign swelling or a totally treatable infection. Yes, it causes a blockage, and yes, it's incredibly uncomfortable, but unlike cancer, an enlarged prostate or a basic infection is not life-threatening. That being said, you absolutely still need to get a timely diagnosis from a doctor just to completely rule out any cancer risk for sure.
All right, let's get into the solutions. Section 3, medicines and non-surgical fixes.
So if your doctor finds a simple infection, standard antibiotics are going to work wonders. But if the gland is just naturally enlarged because of age, chemical medications called hormone blockers are usually step 1, and they're pretty effective. About 70% of men get significant relief from these. Basically, they shut down testosterone production, which makes the gland shrink over time. Now, for the other 30%, different interventions are needed. There are also some alternative meds out there that work by either relaxing the prostate muscles or widening blood vessels to help take the pressure off that bottleneck. But, just like any medical treatment, there are trade-offs. Looking at the timeline, you'd start taking these admittedly pretty expensive medications in month 1. Then you've got to stick to a strict daily routine for about 4 to 6 months before you actually start seeing real results. And there's a catch. If you stop taking them, the symptoms usually just bounce right back. Plus, these meds can sometimes mask the results of prostate cancer tests, which definitely makes long-term monitoring a bit trickier.
Which brings us to Section 4, traditional surgical options.
To give you an idea of just how incredibly common this whole issue is, consider this. In the US alone, there are at least 400,000 prostate surgeries performed every single year. 400,000! It's actually the second most common surgery in America. I'm sharing this because if you or someone you know is facing this stage, you should know you're definitely not alone. Hundreds of thousands of guys navigate this successfully all the time.
The absolute gold standard procedure is called TURP.
Basically, an instrument is passed through the urethra to carefully scrape away the excess swollen tissue from the inside out. Usually, you're looking at a 2 to 3 day hospital stay for this. The great news is the success rate is super high, around 85%, which makes it a fantastic long-term fix. Only about 15% of people ever need a redo within an 8-year window. Oh, and there's also a similar option called TIP, where instead of scraping tissue, they just make small cuts in the muscle fibers to relieve that pressure on the urethra.
Of course, we have to be real here. Any surgery comes with risks. After this procedure, a lot of guys experience what's called retrograde ejaculation. That's when semen travels backward into the bladder instead of out of the body naturally. Now, medically speaking, it's totally harmless, but it does mean a loss of fertility. On the flip side, a more severe, though less common risk is permanent impotence, which affects roughly 4 to 8% of patients. These are just the very real, concrete facts that you and your doctor have to weigh together.
Finally, let's look at Section 5, Modern and Alternative Therapies.
So, modern tech gives us some pretty fascinating alternatives, but they all have their own pros and cons. Take needle ablation, for instance. Been around since 1996, uses precise radio waves. It's an outpatient thing with a way lower risk of impotence, but your urine flow afterward might not be quite as strong as with traditional surgery. Then, you've got microwave therapy, which can slash symptoms by an awesome 75%. But you might deal with a temporary urinary blockage for a few days post-op. There's also laser therapy. It uses heat to break down tissue, which then naturally flushes out, though it can take a few weeks to really see those final results. And lastly, the balloon or stent method. This literally just widens the tract without any cutting at all. The downside? A balloon usually only lasts about 2 years, and stents can sometimes get clogged with tissue buildup over time. It's all about balancing your recovery time against very specific side effects.
So, what does this all mean for you? Which balance of risk and recovery makes the most sense for your own personal health journey? Honestly, having accurate information is true power. After walking through all this today, you've got the solid groundwork to go have a really confident, informed chat with a specialist. Listen to your body, don't ignore the warning signs, and choose the path that gives you the best quality of life. Thanks so much for joining us for this explainer, and we'll catch you next time.